I think every new grad wishes they had learned in nursing school. Let's face it, nursing school gives you a ton of theoretical knowledge, but there are a few things that many new nurses wish they had learned or at least been better prepared for before they hit the floor. So here's the thing, I'm a nurse for 20 years, and I remember being in your shoes. I remember thinking, why didn't they tell me that in nursing school? One of the things I wish that I had learned was how to feel my feelings. I wrote this book called Shit They Don't Tell You in Nursing School because I did not learn how to feel big feelings appropriately, like when a child passed away, or when I had an unexpected code, or when the day was just like insanely stressful and I was so frustrated and just felt like I was being pecked to death by chickens. Like, nobody taught me what to do with that frustration. And that's one of the things that led me to believing that nursing was the cause of my burnout. So, number one thing that I wish that I had learned in nursing school, I wish I had been taught how to properly navigate those big feelings that come with the profession, the guilt, the shame, the overthinking, the anger, the fear, the stress. Like, let's face it, nursing is one of the most high stress jobs that are out there. Like, you literally put that RN behind your name and you're in charge of people's lives. Not only are you in charge of people's lives, but you're in charge of the experience that they have while they're in your care. And understanding how to manage that stress, those big feelings, and prevent burnout is critical. And it's often not taught as part of the curriculum. Now, I've said in a prior video that like burnout is not a nursing problem, it's a perspective problem. And I did not learn that until I had completely burned out and walked away from the profession altogether. I wish that I had learned more about self care, about mental health. One tip that I'm going to give you about how to handle stress and how to handle those big feelings is a journaling exercise. And if you're not a journaler, fine. Like, open up your like your audio recording in your phone and like talk it out. If you're not a writer, then talk it out. It's the same thing, but the strategy is to actually turn your stress or your fear or your anxiety or your anger, whatever it is that you're feeling inside of you, personify it and become a pen pal or become a conversationalist with it. Like, for example, for me, when I'm feeling really freaking frustrated and I don't like quite know what to do with that feeling, I will turn frustration into a pen pal and I'll write to it and I'll say, hey, frustration, I feel you in my body. I feel you in my shoulders. I feel you with intensity, like in my throat. Like, I just want to scream. And you've got my shoulders all bunched up and like, I feel you here, but I don't know what you're trying to tell me. I don't know what you need from me. And then turn around and respond as if your frustration, like, hey girl, this is your frustration. What I really need from you right now is to just go freaking scream at the top of your lungs until you don't feel me anymore. Right? Like, you're going to get some really good information from the way you're feeling. Now, remember, the body is the conduit of consciousness. So when you allow the feelings in your body to talk to you in that way, and when you honor the stress that you're feeling rather than managing it, you lean into accepting it as part of the experience and inviting it and allowing it rather than existing it and thinking that's wrong to feel stressed, to feel frustrated, to feel anger, because it's not. Like, those emotions are as much a part of us as joy, as happiness, as excitement. It's all part of this beautiful tapestry that it is to be human. And so it's learning how to honor those things in ways that serve you rather than suppressing them, which leads to burnout. Okay. Number two thing most new grads wish they had learned in nursing school is real world clinical skills. Am I right? Like, nursing school teaches you the best that they can about the theory behind medical practice, and they give you skills labs. But then when you get out into the real world and you're like starting IVs and you're handling emergencies and like learning how, like, how do I really get that like EC clamp on that bag and bag at the right rate? And like, what is that really like? let's face it, there is a gap between the theory and the practice in the skills lab versus what actually happens at the bedside. And that it can also be totally dependent on what hospital system you work for, because you may totally have your IV skills down at one hospital with a specific set of supplies, but then you go to another hospital and the supplies are completely different. And now all of a sudden you're like, holy crap, I forgot how to start an IV, right? So, what I want you to hear from me is that nursing is always changing. Skills are always evolving. Equipment is constantly swapping in and out. And you can walk in one day and have something completely different and need to learn, relearn those clinical skills. So, what I want you to take away from this specific topic, real world clinical skills, is that it's always changing and evolving. So, don't be so hard on yourself when you get in the real world, or you've been doing it for 5 years and all of a sudden the equipment changes and you feel like you're brand spanking new again. I want you to know that that is okay. Become a chronic learner of clinical skills. Make the decision that no matter what changes, what shifts, whether you're working with a 105-year-old patient with super fragile veins, or a 2-day-old baby with high bilirubin, or your jacked bodybuilder with like veins you could put a 16 gauge in, regardless, if you decide that you are going to be a master at starting IVs and drawing blood work, and you commit yourself to that clinical practice in the real world settings, you will grow, you will learn, you will become a master at those skills if you make the decision to. So, number one, don't be so hard on yourself when you get out into the real world. If you realize that like what you learned like has a big gap between what's actually happening. And number two, have faith that all of these clinical skills are learned, which means that you are totally and completely capable of mastering these skills. Just dedicate yourself to being a learner and to falling into the practice of mastering each of these clinical skills. Like, just decide that you're going to do it. And when you step into that decision and you dedicate yourself to growing your clinical skills, you're going to be just fine. Okay. Number three thing that every new grad wishes they had learned in nursing school is how to have effective communication with patients and families. Like, holy smokes, patients and families can be so incredibly, like, they can be dramatic, they can be emotional, they can be mean. And learning how to stand in those moments and have those crucial conversations with your patients and your families are going to make or break their experience and your experience. Remember, we're the bridge. We are the point of contact from the patient to the rest of the medical system, right? And our job, what that patient is coming to the hospital and paying for, is for us to serve them, is for us to advocate for them. And what that takes is to detach from any specific plan of care or outcome that you might know would be best for the patient, and just listen to what it is that they're telling you that they need from this experience. A perfect example is this gentleman came in. We suspected he was drug seeking, but he was certainly like sweaty, he was tachycardic, he was hypertensive, he was super cranky, and he was incredibly demanding about what type of care he would and wouldn't participate in and how he wanted that care done. He wanted the IV placed, but he didn't want the labs drawn until he got his pain medicine. Okay. And if I had been attached to, like, I'm sorry, sir, that's not the way that we do it here. I'm putting myself as the primary person and forgetting that I'm here to serve him. So I just took a breath and I said, what I hear you say is that your priority is pain medication. Is that right? And he said, yes. I said, awesome. Thank you for helping me understand. And then I was able to educate him about when the doctor puts the order in, then the pharmacy has to verify it before I can even get the medicine. So in the interim between now and the time the medicine comes, we can both get what we want by starting the line, drawing the labs, getting those down to the lab. By the time I drop those off, your medication will be ready. Is that okay with you? Right? Like, just staying calm and remembering that you're here to serve the patient goes a long way in being able to be empathetic, to be clear, to be supportive while being professional. I find that the times that I get the most triggered and like lose my professional cool is when I'm too attached to the way I think things should go. And I'm not listening to what the patient is actually asking for. Now, granted, there are patients that come in with really unrealistic expectations. And in those moments, it's about saying, I understand that this is what you want, A, B, and C. And what I need you to know is that in this environment, this is what I'm able to provide you, A, B, and C, right? Like I'm not able to go above and beyond that, and helping them set realistic expectations because you're detached from the conversation. Number four, every new grad wished they had learned in nursing school the importance of teamwork and navigating hospital politics. Like, woof. Nursing is not a solo job by any means. We collaborate with doctors and respiratory therapists and lab techs and social workers and other staff members and techs and CNAs. Like, holy moly, many nurses feel like they didn't get enough training on how to be an effective part of that team, how to delegate well, how to ask for help when they need it, how to use their voice in the midst of like that hierarchy, right? Like I'm the physician, you're the nurse, or when you're having a challenge, you go to your charge nurse first and then your supervisor and then your director. Like what's the proper way to communicate what you need in the middle of this like political, like constantly moving mashup of humans that now become your teammates. I mean, there's all sorts of different dynamics, like in the team and the hierarchy, and sometimes complicated relationships. Let's be real. Like, we don't always get along with everybody. There may be personality things going on. And new nurses often wish that they had been better prepared for dealing with those different personalities and working with the physicians and managing conflicts. And this is one of those areas that like I personally worked hard to grow in on my own outside of healthcare. I have a great book recommendation for you. It's called The 15 Commitments of Conscious Leadership. It's written by Jim Dethmer and a couple of other co-authors. And what I love specifically about this book is that it's number one, it's more geared toward business. So it's written through the lens of like owning your own business. But if you can take those principles and apply them to you being the CEO of yourself and how to have better candid conversations and how to commit to feeling your feelings and how to really commit to a life of rest and play and exploring the opposite. There are so many incredible strategies and commitments within that book that helped me go professionally so I could learn how to delegate well, how to ask for help, how to express my gut feeling and my concerns, where to go and how to have a conversation when I felt like my needs in the professional setting were not being met. So if you need a resource, first of all, just message me. I'm so happy to help guide you through anything that might come up there. But also, 15 Commitments of Conscious Leadership is an excellent book that will support you in growing your own interpersonal skills. Last and not least, tip number 5 is basic financial skills. Like, holy crap, you get out of nursing school learning how to manage your finances, especially if you are a young adult and nursing is your first profession. You're like managing day-to-day finances, you're managing student loans, you're like starting to learn about what does it even mean to plan for retirement, or can I even negotiate my salary? Like those basic skills are so important and make a huge difference in your day-to-day experience. Like when you feel like you're educated and truly governing your own finances, whew, so much less stress. And there's plenty that I'm still learning myself, but like I've gotten myself into a hole trying to manage student debt and like racking up credit cards and, just not knowing where to turn when I didn't have enough income to pay for groceries. And then like all of a sudden the dog needs surgery and all of that life that's lifing. I wish that they had taught me a little bit more about how to manage my basic finances, how to negotiate those salaries, how to take full advantage of the financial benefits, the part-time disability, the full disability, the health savings plans, the 401ks, like what does it all mean? And how do you maximize leveraging those financial benefits so that you set yourself up for a really great retirement. The last thing I want you to do is to walk away from nursing with nothing left in your bank account. I'm going to give you one tip specific on these basic financial management skills. I got really great advice from a coworker who had been doing nursing for a long time. And he said, if you do nothing else with these benefits, I want you to contribute to the 401k at the maximum amount that the employer will match. So, like, I think back then I had to like put in 7% of my paycheck. And if I put in the full 7%, the hospital matched the first 5%. That's literally like getting paid for free just for putting your own money into a retirement account. And then over time, you get the benefit of that money with compound interest. So even if you don't understand compound interest and all you do is go figure out how much do I have to invest in the 401k in order for my employer to match that investment and just do that, that's one step in the right direction. I'm going to give you a bonus things that every new grad nurse wish they had learned in school, and that is handling legal issues and malpractice. Understanding the basics of healthcare law can help you prevent making mistakes and mitigate the risk of legal trouble. There's a lot of conversation around, should I have my own malpractice insurance as an independent nurse outside of the hospital? And that's a decision that only you can make. But also remember that what you either do or do not chart in a patient's chart can get you in trouble. Like, for example, I know that skin assessments are a big deal. And if you chart that the skin is within normal limits, but miss a pressure ulcer on a patient's backside, then you are in trouble for falsifying documentation. Versus if you just don't chart a skin assessment at all, you can't get in trouble for that pressure ulcer that gets discovered later, right? So, like, that's just one basic tip. But I would encourage you to reach out to your employer and find out, are they having any classes on legal documentation and how to protect yourself and how to know, like, what can I and can't I chart that will or won't get me in trouble, that will support showing how good of care I'm actually giving to the patient. That's going to be in your best interest as a bonus for 5 things every new grad wished that they had learned in nursing school. I hope this video helped you. Until the next perfect time, much love.